Hey guys, it's Dr. Nate here at Thrive Dental and Orthodontics, and today I want to talk to you about what you need to know before you start braces. Alright guys, so I want to talk to you about the 4 top things I think you should know before you start orthodontic treatment. Okay, so number 1 is you want to know, well, you want to have an idea of what type of treatment you want. So there's multiple different ways to move teeth. You can move teeth with metal braces, clear braces, so both of those go on the front of the teeth. You can do them with lingual braces, that's the one that go on the inside of the teeth. You can do it with Invisalign, and honestly those are probably the top choices. So you don't necessarily need to know, hey, for sure, like I want to do lingual braces, or for sure I want to do Invisalign. But if you do have something specific, you want to know, or you want to make sure that your orthodontist provides that, because not every orthodontist provides Invisalign. Not every orthodontist provides lingual braces. Not every orthodontist does clear braces. There's even some gold braces out there. So there's a lot of different choices. So you don't necessarily need to know for sure which one you want to do. But if you do know, if you already do know that, then you should probably make sure that your orthodontist provides that option. Okay, so that's number 1. Number 2, which I think is very important, I think you should be treated by an orthodontist. Okay, so this is a little bit hard for me because I'm an orthodontist, so I'm a little bit biased towards this, but I think this is very, very important for most cases. You know, if it's something super, super simple, it's probably okay to just have anybody treat you, or a dentist treat you. But if you want it done very, very properly, an orthodontist is the best choice, and this is the reason. So would you take your car to a mechanic shop that maybe services your type of car once a month? Or would you want to take it to a shop that services your type of car 10 times a day? And obviously you'd want to do that one because they know, they have all the parts there, they know exactly what's going to happen, they know the ins and outs of your specific vehicle. So it's kind of the same thing with an orthodontist. Yeah, there's dentists that do orthodontics, you know, a couple times a week or maybe a couple times a month, but an orthodontist is doing, you know, seeing probably 10, 20, 30, 40, 50, 60 patients, 70 patients a day. So of course we are going to know the ins and outs of braces, of Invisalign, of all the different type of orthodontic treatments because we just see so much of it. So we know how to, you know, open spaces, close spaces, bite corrections, all of these different types of treatments we know how to do just because we do it so much and that's all we do. So I think being seen by an orthodontist is very, very important. Number 3 is you want to know what type of treatment you are getting. You want to know how long the treatment is. You want to know, are you going to use appliances? Are you going to use anything different? Extractions. You know, you want to know, make sure that you know what is going on in your particular treatment. And we get tons of second opinions here. And it kind of blows my mind when I talk to the patients and they go, okay, what did you like, not like about the previous orthodontist? How did the last consult go? How long did they tell you the treatment was? Did they say they're going to do anything special? And the patient's just like, yeah, I don't know. We're just going to do braces and that's it. And that is kind of crazy to me because there's some treatments that are literally a couple months, and then there's some that I'm like, oh my gosh, this is going to be a couple of years. You know, so there's huge differences. Then sometimes you need to take out teeth. Sometimes you need to use like different types of appliances, like a Herbst or forces, or different types of appliances to get the best result possible. So it's very, very important when you're being treated or when you do the consult to know what's going on. So you just want to know, like, hey, are we going to need to take out teeth? Or hey, is this going to take 2 years? Or is this going to take 2 months? You know, you want to know the difference to make sure that your treatment goes as smooth as possible and you're as knowledgeable as possible as well. So that's number 3. Number 4 is finances. So finances is obviously super important and may be the most important to some of you. And this is interesting because sometimes we'll get people coming in and they'll say, hey, you know what, I'm going to be treated at this other office, but they're going to charge me $3,500 or something pretty low for a full case of braces. And I'm like, whoa, that's an amazing price. But then I know the offices that they're coming from and I know what happens. So the office will go, cool, $3,500 or $3,000 or whatever it's going to be for your treatment. But as you go through it, they'll go, oh, you know what, you missed that appointment, and so treatment's gonna go a little bit longer, so we're gonna charge you a couple $100 every month you come in. Or, hey, we're gonna charge you $50 per broken bracket. Or at the end, hey, we're done with this, but now you need retainers, we're gonna charge you for that. Oh, and actually we need x-rays too, and we're gonna charge you for that. And it's just funny how many extra add-ons. People get added on to the treatment when if they would have been honest up front, they would have known the full price. So for here, what we do is we go, hey, this is the price, and that's it. You know, that includes the molds we have to take, that includes the x-rays, that includes the retainers, that includes all the visits. It just includes everything. So we don't want to kind of like come back at you later and say, hey, you know what, you actually owe us some extra money because we need to take these x-rays, or we need to do something here, we need to do something specific. So that is super important. So knowing the finances and also knowing your insurance, which I did another video on that when it comes to braces or orthodontic treatment and insurance, but that is also important. So those are the top 4 things that I think are important. Remember, number 1, you want to know what type of treatment you are getting. So if you want specifically clear braces, if you want lingual braces, if you want Invisalign, if you want something specific, make sure your orthodontist provides that. You also want to be treated by an orthodontist. I think that's really important. You want to be treated by somebody who is doing this all day, every day. They know the ins and outs, and you're going to get an amazing result. Remember, you should only do orthodontics once. As long as you wear retainers, you should only do this once. So you just want it done very, very properly. You want to know what type of treatment you're getting. So you want to know how long it's going to be. You want to know if you're going to need any appliance, if you're going to need extractions. You want to know your treatment and how it's going to go. And then lastly, you want to know the finances. You don't want to get stuck midway through and being nickel and dimed for all these little extra tedious things. You just want to have your fees set out and it be finalized, and so that you don't have to go back and kind of mess with your finances. So that is the 4 top things you should know before you start your orthodontic treatment. Thank you so much for watching. If you have any questions or comments, please leave them below and I will do my best to answer them. Thank you so much.